Okay, we're going to demonstrate how I adjust pregnant women. And obviously Gladys here is well into her third trimester and constantly battling with low back pain and mid back pain. And go ahead and swing your legs around here. I'm going to start with her mid back. And basically I'm just going to use her own body weight. Clearly she can't lay on her stomach and have me do a normal adjustment. So we're going to use her own body weight here. Keep your head ducked down. Come on back. I don't know if you could hear that on the film, but her whole thoracic spine just clunked right back into place. Let's get you on your side facing me. Now again, we got to kind of change our system a little bit. Normally we'd layer the patient on the side, bend this like this, but with her belly, it's just not going to fly. So basically I step through here, her leg's resting on my leg. So there's no pressure on her belly. Contact here, boom. And we just click the low back right back in where it needs to be. We'll slide her over. There we go. Doing the same thing here. Again, legs up. There's no pressure on her belly here whatsoever. Beautiful. And again, that whole thing clunked right back into place. And that's how we adjust pregnant ladies here at the office. Thanks.